There's your objectives. So when you're studying, just go back and take a look at those objectives and make sure that basically they're covered enough for you and you can answer those. Okay, interactions between hosts and the pathogen. So what is actually happening? All of it is really going to depend, or most of it is going to depend on the status of the host immune system. Whether the person's healthy or immunocompromised will determine the outcome of whether they're going to get an infection or not. Therefore, that would make sense with the ability of the host to defend itself against microbial invasion. Is the person on chemotherapeutic agents? Is the person stressed? That type of thing. Microbial factors inherit the invading organism. This would be something like, what does that particular organism have? Do they have capsules? Is it going to be more virulent? That type of thing. Okay, remember we talked yesterday a little bit about capsules, and it will make the organism more virulent. All right, so characteristics of indigenous microbial flora. Indigenous, what am I saying when I'm saying indigenous? Am I saying that it stays there for a little time and leaves, or what's going on with indigenous?
Naturally found.
Yeah, naturally found, that it's sort of a normal or usual resident. Okay? That therefore, resident, that one's a little tricky. You want to say that one can stay in the area for months or years. Transient, you want to think of that one as visiting, that's temporary, okay? It usually will be eliminated by either the host or immune defenses for the transient, okay? And then you also have something called carrier state, which is referring to the host condition. Host condition, if you're saying that somebody is in a carrier state, they are still able to infect someone else because they're in a carrier state. Like Salmonella typhi is a great example. You guys have ever heard of, what was it, Bloody Mary? That carried Salmonella for like hundreds and hundreds of people, and it was coming out in her stool, basically, and she was a cook up in New England.
Oh,
Yeah,
Did you ever
I've
hear
heard of
that?
Yeah.
I think it's Bloody Mary, or am I thinking of something else?
No, you're right.
Yeah.
And she was actually, I just recently read it or saw a thing about it. She was like, by law, like not allowed to work in a restaurant.
they
She
finally-
kept doing it.
it like she knew, like.
She kept just going from place to place to place, and it would just be shedded in her stools.
She finally got imprisoned.
Well, thank God. Oh my God. I don't want to eat anything. Wow. Well, you're not going to eat anything, or you're not going to have sex after I tell you this one. Have you guys, did anybody catch the little link that I put up? On
The
Pathogen?
Ebola one.
How wild is that?
Oh my gosh. It was like,
Is
they
that
thought it was 90
wild?
days, and now it's like doubled out or something.
Wild. So you have Ebola, right? You need to wear condoms. What did it say? Like the rest of your life? or
Yeah,
something
basically.
indefinitely?
Wow.
And that's just something that they just found out like recently. So that was kind of creepy. Yeah. Okay. Just kidding. All right, factors that are going to determine the composition of usual flora. So nutritional and environmental factors, ability of the ability of the organism to resist antimicrobial effects of substances, such as like bile and lysosome or fatty acids. pH is another one. Again, going back to the female genital tract, the pH of that, the environment's usually 4 to 5. If it gets altered, that's when you usually can have infection. Okay? And then, of course, the changes in age and nutritional status, disease state, drug or antibiotic effects. With that one, you're looking more or less at opportunistic infections because the host is damaged, basically. Okay? So, usually, like an example of that would be gram-negative pneumonia with diabetics or alcoholics. That's very prevalent in both of those cases. This just gives you a list of the usual flora of the skin. The skin is, again, it's going to be your best protection or barrier against microbes, but these guys usually do hang out on the skin. You can see staph is right there. I forget what the percentage was, but there's a ridiculous high amount of people that just carry staph normally around. And like I was just saying too, supposedly you can reduce the bacteria present on your skin by 90% if you're using good very accurate, does it?
Doesn't sound like something you want to do anyway.
I know. That'd be like the whole hand sanitizer thing. You wouldn't want to be doing that constantly over and over and over either. That's not good for you. All right, usual flora of the mouth. On the mouth, you're looking again, especially on tooth surfaces, at biofilms. We were talking about biofilms yesterday. Very prevalent and well-formed biofilms. And that's where your plaque and anaerobic bacteria come into play. So usual flora of the respiratory tract. This one's going to be divided into the upper tract and the lower tract. Let's see. What I did want to point out, though, is that in the nasopharynx, a lot of people don't realize this, but you have Haemophilus influenza and Neisseria meningitis, part of normal flora, with a lot of people that just walk around like that and healthy individuals. So that's pretty interesting. Okay, and then interesting too, hospitalized patients often show colonization with gram-negative rods. Anybody want to take a stab at why that would be? Why gram-negative rods for hospitalized patients? Well, you could say that, I guess. Like if you're talking about UTIs and catheterization and stuff, I'm thinking about getting, what is it called when they, not incubate, is that what it's called?
Yeah.
When they, with feeding tube and different things like that,
Yeah.
intubate, right? A lot of gross stuff hanging out on that kind of thing. We're getting gram-negative pneumonia in the hospital. So just an interesting little fact about hospitalized patients. Gastrointestinal tract. So that's what's included in the gastrointestinal tract, the very first point, okay? There's a lot of defenses and they're effective antimicrobial factors in there, particularly with the bile and the acidic pH. Microorganisms are present in ingested food and they're going to act as transient flora. You do have the stomach is usually going to be sterile because of the pH, but this particular bacterium can get in. Have you guys heard of this one in 2010, Helicobacter pylori? That one is indicative of ulcers, and if it's left untreated, a lot of times people end up getting stomach cancer with this one. Okay, and also the GI tract can be altered by antibiotics, which we all know. That's why you should be doing what are they called? Probiotics. I'm like prokaryotes. Which yes, kind of, yeah. Probiotics when you're on antibiotics because you're flushing out all your good stuff, right? And getting diarrhea, which is even great. Okay. GI tract, you have kidneys, the bladder, fallopian tubes. These guys are normally free of microorganisms. Composition of vaginal flora. This one is interesting. That's consistent with hormonal changes in age. So what women are going through in puberty is going to be different than what the normal vaginal flora is during childbirth years. Okay? And there's also the pH environment, which I went over before about the lactobacillus that plays a role in the vaginal tract. All right. So what is the role of microbial flora in the pathogenesis of infectious disease? So you can have a symbiotic relationship, as we just talked about, or it could be an opportunistic relationship. Usually remember this one, that's going to be when the host is somehow damaged or disturbed, changed, the host system is weakened or stressed, okay? Trauma and surgical intervention can also play a part in disrupting the normal microbial flora as well. And then of course immunosuppressive drugs and chemotherapy and radiation. I mean, people getting ports put in for chemotherapy, right there, that's like a huge one for bacterial infection most of the time. I'm sure like everybody in this room probably has some kind of story that they know of somebody with a port or with a catheter, you know, when you go into the hospital and they get secondary infection. Good times. All right. Let's see. Development of immunological competence depends on the microbial flora. It depends what you're dealing with, basically, if it's indigenous or transient. Sterile environment versus exposure to microbes. That's the whole thing right there about exposing like babies to germs. Do you have a sterile environment where you don't expose them to anything and then they're going to get sick all the time? Or do you take this step and start exposing them little by little to things to help build up their immune system? There's like a big balance there. Did any of you guys have any comment on that one? Because a lot of people, like first-time moms or whatever, they're like, I'm not taking my baby out for 3 months. And then the baby gets slammed with like a double ear infection / strep throat all at the same time.
The sterile environment of that can also help produce allergies in the child then too.
Exactly. That's also proven as well.
That's what happened with one of the ladies I know. Like, I guess she was a stay-at-home mom, and then she finally took her kid to daycare, and now it's like every month there's something wrong.
Every month there's something wrong.
Double ear infection, something wrong, high fevers, taken to the hospital.
Yeah, it's like dropping them in. Yeah, exactly. My first kid, I like didn't take her out literally. I was such a nut for like 2 months till she had her vaccinations, right? And then second kid, whatever. Third kid, we stopped at Publix on the way from the hospital, on the way home. You know what I mean?
Yeah.
It's just like, didn't really matter. And I don't really care anymore. All right, that was a really quick one. In terms of immunity review, you guys, let me just show you this really quick. I want you to just go through this on your own, that little PowerPoint that I have up in Canvas. But like, I feel like you guys have gotten it overboard with Dr. Smith, that this is like for babies, okay? So this is just like the basics of what you need to know from microbiology, like right there in that nice little neat package, okay? So I'm sure you guys don't even need to write this down, am I right?
Yeah, we're good.
Yeah, you're totally good. This is why I don't even go into like the immune responses or anything like that, because it's like overload, right? All right, we have one more short lecture to do, and then you guys are done for the day, okay? Let me just find it first. Did you guys have any questions so far about anything? Doing okay? Okay. What is the next lecture? Do you know? What is it called? Pathogenesis of infection.
Pathogenesis of infection.
There it is. Okay, and this is actually a funky one, or the first one is, I don't remember. There's one where I had some slides on there that were blank. I don't know if it's this one or the other one. If they were blank, you can cross them out. I was going to talk about immune responses, and then I thought, why am I doing this? What is the point? Okay. Objectives, again, these are a little bit more in-depth this time. Basically, we're just going to talk about factors that contribute to pathogenesis and virulence, okay? So know the definitions for the first two, which are very easy, and you guys should know that. And basically, big difference here between like opportunistic pathogen and true pathogen. Opportunistic, like I said before, basically waits for the host to be immunocompromised or something wrong with it. A true pathogen, it's not going to matter. It's going to be able to cause disease in anybody healthy, okay? Let's see, normal flora and clinical infections. So here, because we go under highly invasive medical procedures, insertion of prosthetic devices, like I was talking about ports, that makes somebody more susceptible to infection, okay? Let's see, you want to determine whether the isolation of a particular organism is a pathogen. So you want to consider the human host and whether the host does have an underlying disease. And then the last little thing, how do you say that? I'm like, this is my brain today. Lauren, help me out.
Pathogenesis.
Thank you. This is going to be an infection that occurs as a result of medical treatment or procedure. And that's just some fungus.
It's like a Christmas tree.
Oh, it is
a Christmas
It's
tree.
a Christmas tree.
I get it.
Yeah, get it? Merry Christmas. Okay, now you're sick. All right. Virulence. So this is going to be the cause of the disease or the degree of the pathogenicity. To what degree is it going to cause disease and how bad is it going to be is how you want to remember virulence, okay? Usually you're going to have a measurement of the microorganisms that will be able to infect the host. So low infective doses are considered more virulent. For example, Shigella has a low infective dose. It takes something like less than 100 of the organisms to cause disease, whereas another one can have a very high infective dose. Okay? So in terms of mechanisms of virulence factors, this again, we're talking about capsules, stuff like toxins, we're talking about endo and exotoxins. Okay, these are going to allow the pathogen to overcome the host defenses. Okay? All right, ability to resist phagocytosis. This is a really big one. You have a couple different examples of how it's going to be able to resist phagocytosis. Okay? Let's see. If you have a lack of phagocytic cells, that's going to leave the host susceptible to infection because obviously it's not like doing its job. Okay? But basically, the most common method is having a polysaccharide capsule. There's a capsule, again, on the surface, and that's going to be able to resist phagocytosis. Think of the Pac-Man effect, that it can't get its mouth around the bacterium because of that damn capsule, okay? Protein A, that was an example I wanted to point out. Staph aureus has something called protein A, and that avoids phagocytosis by interfering with the binding of the host antibodies on the surface cell of the organism. So protein A would be indicative of something like Staph aureus, okay? All right, surface structures. This one, I don't even know why I put this slide in. You have adhesions and fimbriae. We all know what that is, right? Not really sure why this is in there. Obviously, remember that the fimbriae pili increase the colonization ability, and adhesions are basically going to help it adhere in the bacteria to the host cells, okay? All right, ability to survive intracellularly and proliferate. Overcome lysosome. What's lysosome?
Down near tears.
Tears, it's in tears, it's in sweat. There's a couple other things, maybe bile.
Proteolytic enzyme.
It is enzymatic, but it's in a lot of different bodily functions. Let's just say that. Okay, IgA. Also, if there's a shift in the key cell surface antigens, if there's survival inside macrophages, that can happen as well. And then, of course, there's invasion. Okay. Let's see. Toxins. Ability to produce extracellular toxins and enzymes. Remember, when we're talking about toxins, even though that you want to keep thinking about gram-negatives in terms of toxins, you do have both gram-positive and gram-negative. So gram-positive toxin, one of them that a lot of people tend to forget about is Staph aureus, has the toxin which causes food poisoning. So that's very common. So it does stuff besides the whole skin thing, okay? Endotoxins at the bottom there, remember we were talking about the LPS, okay? Highlight that because that's pretty important and that will come up on the test as well. I do spend a lot of time on endotoxins and LPS. And this is basically kind of a review from yesterday when we were talking about exotoxins and endotoxins. Okay, this will just give you a little bit more of a distinction between the two of them. These guys, you need to know the difference. I might ask you something like compare and contrast exotoxins versus endotoxins. So just look at this slide, and then, of course, look at the next slide and make sure that you can tell the difference between the two. Okay? Do you guys have questions about the exo and endotoxins? I think you guys are pretty good, right? Okay. All right. What are some of the host-resistant factors? We have physical barriers. What's a physical barrier that we have? Skin, right off the bat. Cleansing mechanism, what about that? What do we have?
Shower.
Shower, right? Sweat, eyes, respiratory, digestion, anything fluid-wise we have. Antimicrobial substances. The hydrochloric acid in the stomach would be a good example of that, okay? Which would keep the stomach sterile, except, of course, if you get Helicobacter pylori. Indigenous microbial flora. How does that help host-resistant factors? Like, what is the purpose of the indigenous microbial flora?
You don't see it pathogenesis.
Exactly. They occupy the space, basically. That's always what I like to kind of point out to you guys. It's like, this room is not full. So basically, we are, in this class, susceptible to an infection because all these seats aren't filled. You get it? But if they were all filled, there's no room to compete for those seats, right? It's the same thing. And then, of course, phagocytosis is another big one. And we've Pac-Maned it to death, right? Right? Okay. Indigenous microbial flora. All right, we just talked about that, competing with the pathogens for nutrients in space. We can also produce metabolic byproducts, such as vitamins or essential nutrients that are synthesized by certain bacteria. Okay? Now, phagocytosis, remember these steps, but you don't have to go into detail. Okay? Just remember chemotaxis, attachment, ingestion, and killing. Okay? Would be the basic steps for that. Alrighty? Little picture. Very neat picture. These are some examples right here. I'm not going to ask you, I'm trying to think if I do ask you any of this on the test. I want to say the answer is no. Just good for you to take a look at, but I don't ask you any specific questions from this slide. Okay? Just some examples for you. See, aren't I nice? You could be like grabbing a bunch of stuff from here. Alright, inflammation is another part that we're talking about. Response to injury or foreign body, okay? Usually you're turning red, right? Because you're releasing mediators. There's greater blood flow. You have edema. The great thing with that, if you continue the phagocyte accumulation, that's when you can result in pus. That's basically your staph infection when you have it with the skin. All that crap under the skin has to get drained out, okay? That's just a picture of somebody getting kind of stabbed there, and then the nice little pustule pocket that's forming. I don't know why I'm laughing at that, but it's great.
Look at people left.
I know. When I get nervous, I start laughing. I don't know why this is making me nervous, but I cut the crap out of my arm this weekend on glass, and I was like, crap. Because the whole thing like turned red. So I don't know, I'm paranoid now that there's gonna be like this pus or something that's gonna start coming out of it. So, okay. Immune responses. This just goes back to the board, what we talked about between innate and adaptive. I'm really not spending time on this because I feel like you guys are well versed in immunology. Okay? And then you guys will have 2 slides that I didn't put anything on. You can cross those out. There were primary and secondary antibody responses, I think, and cell-mediated immune responses. Just cross those out. I don't even know why I had them in there. We're not doing anything with that. So this is the last little thing here. Tolerance, immune suppression, also changing surface antigens during the course of a single infection can actually lengthen the infection itself. And then surviving inside infected cells are also a way that microbes can overcome the host defenses. Okay? Lack of host response or tolerance, that's what's creepy. Because that's what you're talking about, like the antibacterial soaps and the hand sanitizers. These are the infections that like most of the little kids get all the time, just because their parents are antibacterial sanitizer happy. And so they build up tolerance to it, basically. And that's what happens. Okay, and these are your routes of transmission. All of these are very self-explanatory, right? Do I need to go over any of these? No?
Do
You guys have these?
Is that animals?
Yes.
Okay.
Mhm.
Virus.
Roots of infection, that's a pretty good picture. Dun, dun, dun. Okay, and then just your points that you need to remember from